Maintaining a profitable healthcare group can be a challenge, but leave it to the folks at MediSync to take a group from the brink of bankruptcy to the picture of profitability. Andy Roesgen traveled to Ohio for the story.
If your medical group successfully manages the hypertension of 47% of its patients, well, that's about average. But there's a medical group that successfully manages 90% of its hypertension patients, and that's tops on the list for the AMGA and the CDC. And that medical group is right here in Dayton, Ohio.
I kept getting dizzy every time I stood up.
A few years ago, Carol Straubing came to Dayton's PriMed to treat her hypertension. Her previous physician in Cincinnati had prescribed her hypertension medicine that made her so dizzy she eventually passed out.
So here it is, New Year's Eve, I'm in the emergency room.
But what PriMed did for Carol and its other hypertension patients is, quite simply, figure out how to give them the right medicine. Not as easy as it sounds, and that's why this small group of 60 family practice doctors and pediatricians is the best in the AMGA's Measure Up, Pressure Down campaign.
We set a goal for chronic disease management, hypertension being one of them, that we would get our patients to 90% of the evidence-based goal. That was thought to be ridiculous in 2001.
But PriMed couldn't have done it without the management company MediSync of Cincinnati. In fact, PriMed probably wouldn't have survived without MediSync.
We lost not only our startup money, but also pretty much $1 million within the first year.
In that first year, 1996, PriMed formed from a handful of individual practices, thinking they could just band together, handle their own finances, and float along. But they were wrong, and they nearly went bankrupt.
That's when we met Bob Matthews, MediSync, and they really had a very logical plan for us. They not only knew business, but they knew medicine, and they could see the way things were changing.
Doctors Maureen Perez and Doug Romer say their reimbursement rates were the worst in the country before MediSync started renegotiating value-based, outcome-based contracts, years before that idea took off nationally.
We were doing value-based medicine before we heard the word value. But we just weren't getting reimbursed for it.
We're in Cincinnati and Dayton. We have Procter & Gamble. If they want to change the way Tide smells, they have this enormous plan for how they're going to go about it. We're changing the biggest part of our business, the financial model, and we took a lot of time to plan.
In fact, while most hospitals lose tens or hundreds of thousands of dollars on each of its primary care physicians every year, the doctors working with MediSync are financially self-sufficient and earn at or above the national average for their specialties.
Do you do any other sports at all? No? Okay, good. School's going well? Yeah. Grades are good? Yeah, okay, good.
But beyond the business side, MediSync helped PriMed by developing processes for delivering health care. Of course, plenty of doctors hate that term. They think it means a loss of their control. But PriMed doctors say because they've been fully engaged in the development of the processes, they're on board.
It makes it easier to follow. You know what steps that you should take. And our patients are the ones who are benefiting, which is ultimately what we want.
It's very much about making sure that they understand what it is we're trying to accomplish as an organization, and that we communicate clearly what it is we're trying to do and why we're trying to do it.
But it's not just about hypertension. A few years ago, PriMed's 24 pediatricians took about a year and a half to take this enormous book of government guidelines on asthma and turn it into a process for asthma treatments. And the results speak for themselves.
Fewer hospital visits, fewer emergency room visits, patients using their controller medications, so.
Less days missed from school, less days missed from work.
And PriMed doctors say their achievements in hypertension, childhood asthma, and reimbursement rates are just the start. With help from MediSync, they'll keep on getting gold stars, and their patients, like Carol, well, they'll just keep on feeling better. In Dayton, I'm Andy Roesgen.